I'm Janet and I'm a child life therapist at the Children's Hospital at Westmead, and I have had the great privilege earlier in my career to spend 9.5 years as the child life therapist at Bourke, which is the children's hospice located in Manly, which is also part of the kids hospital at Westmead. And I guess that's what's brought me here today, because in that role I had the great privilege of working extremely closely with the clown doctors. It was a very small, residential, much more intimate environment, and so it was fantastic to be able to work really one-on-one with the guys and be involved in activities that they were doing with the kids at the time, whereas the dynamics are slightly different in a hospital where they're walking around the entire hospital and interacting with staff for shorter periods of time. Clown doctor days were always my absolute favourite days of the week, and when I see the guys around the hospital here, it always brings such a huge smile to my face. When I think about clown doctors, I think about magicians, comedians, acrobats, people bringing humour, people who are therapists, people who are, most importantly, I think, seeing kids as kids and not as a diagnosis, and people who are seeing the entire family and how important that is to be recognising all of the members of a child's family, and also people who are just bringing joy to an environment. So people who are looking at the doctors and the nurses and the other staff around and knowing that it's also important to have them have a smile and a laugh for the day, and that's going to impact on the patients and families as well. The three really crucial things that the clown doctors do are, most importantly, smiles and laughter, and that applies to the kids, to the members of their family, to the staff around and about, to visitors, to volunteers, and creating an environment that's about laughter and happiness and fun is got to be good for everybody's health and really improve the outcomes of the kids. One of the other things that I think is critically important, and would be my point number 2, is that ability to, I guess, create really intimate, precious moments. And I think that sometimes perhaps in a busy hospital, when you create that precious moment in the emergency department when a kid's just had a terrible trauma happen to them, or in the palliative care unit when the child is in the last few weeks of their lives, it may be hard to realise the impact that that has, but I know from my 9.5 years in palliative care that it is those moments that are remembered. And I think the third point that, I guess from my clinical point of view, is really important is that what we know as clinicians is that there's a lot of research to say that kids' first and initial impacts with a healthcare system can affect their healthcare decisions for the rest of their lives. So if we can make their first, second and third experiences in hospital a time that has involved laughter and fun and some lightheartedness, or just perhaps some special time. Some of my favourite clown doctor moments have been just someone sitting and playing a quiet song on the ukulele, or making the special balloon that that child really wants. So I guess for me, the great thing about the clown doctors is that everybody brings their own tone, their own talents, their own recipe to what they do, and everyone has different gifts, and they are many and weighty, and there's just so many talents, so many memories, so many moments. But I guess if I wanted to summarise in 3 or 4 points, then some really profound and impactful things would be, in a healthcare system that often looks at numbers and words and diagnosis, the clown doctors are there. They are acknowledging the patient as a person. They're looking at children for their abilities and not their disabilities, so that's really fundamentally important. That they always, without ever being reminded, include siblings, which is an incredibly important facet in healthcare. These kids of chronically ill brothers and sisters bear a huge burden in their lives, so having someone who makes them feel special and acknowledges them is fundamentally important. That parents are included, that it's not just about the kids, and sometimes in a children's hospital a lot of what we're doing is really focusing on the kids, except when it might be serious clinical discussions. So including the parents, giving them a laugh, lightening their day, really fundamentally important. And I guess it's the tone that occurs for the overall environment. I work in the emergency department these days, and you can feel the difference in the environment after the clown doctors have walked through, and that's not just about their interactions with the kids and with the families, which are amazing. That's about bringing humour to the staff, to the volunteers, to anyone else who happens to be around, lightening the load and lightening the mood, and providing a healthcare environment that's great for all kids, families and healthcare practitioners.
And I'm sad to say I'm on my way.